Welcome to the training video on community engagement in international health research. According to the CIOMS guidelines, researchers, sponsors, health authorities, and relevant institutions should actively engage potential participants and communities throughout the research process. The process should be meaningful and participatory in an early and sustained manner, from study design to the dissemination of its results. This guideline is meant for all types of research studies, whether they are hospital-based, community-based, health services research, or carried out in educational institutions such as schools. This raises several questions, starting with what is a community, how should it be defined, and who should define the community. Further questions include, should community engagement be applied to all types of studies? How should we define the community in the context of hospital-based research, when the hospital has an intake not only from the surrounding catchment area, but also from the nearby cities? What about research on health concerns of hard-to-reach communities living in far-flung areas? How does one engage with these communities? Another concern that researchers may struggle with is how to determine who speaks for the community, especially if the community leadership is not trusted at least by some of the community members. Community engagement has evolved over time from being a process which involved a one-way exchange of information to being considered what has been termed as a collaborative co-governance of research, with the ultimate goal of empowering communities. This raises the question of scope and applicability. To what type of studies should collaborative co-governance apply? How can researchers determine which studies would benefit from a collaborative co-governance process? There are two other terms that are often used in the context of public health research: public engagement and stakeholder engagement. How are public and stakeholder engagement different from community engagement? And who is the public anyway? Is publics different from public? Community engagement raises a lot of questions, and it would be great to hear from an expert about it, and also the nuances of the term and the process. For this purpose, I would like to welcome Dr. Paulina Tindana, an Associate Professor of Bioethics and Global Health at the University of Ghana School of Public Health. Her teaching and research focus on the ethical, social, cultural, and policy issues in public health, global health research, and health systems research. With academic training in bioethics, she has published extensively and contributed to several international and consortia ethics guidelines and reports, including the H3 Africa Informed Consent and Community Engagement Guidelines. She has also facilitated training workshops on global health ethics and community engagement and mentored several master's and PhD students. Prior to joining the university in August 2018, she worked at the Navrongo Health Research Center in Ghana for over 20 years, conducting social science and empirically ethics research and supporting community engagement activities. Dr. Tindana, in the context of health research, what does community engagement mean, and how is a community defined?
So community engagement largely depends on the context in which research is being conducted, and it's important to take into consideration several factors. First of all, we know that when we do community engagement, it's important to define who the target community is. And who defines the community? Is it a researcher or the community themselves? And it's also important to understand the nature of the research and the goal of the engagement. So this is what will determine how community engagement is defined. So for example, for a study that is aimed at trying to understand the factors that contribute to certain diseases in a particular community, if it's community-based, you would expect that community will be defined in geographical terms. So, for example, if you want to go into a community in the northern part of Ghana or any part of Africa, you would want to define your community based on the geographical location of that community. And that is usually the easiest to do. But we do also know that depending on the nature of research, what the implications of the research is would go beyond the communities that are all located in one geographical village or even a town. So it's important to first of all start off with trying to understand what the nature of the research is. Is it a community-based research or a hospital-based research, i.e., are the participants going to be recruited at the community level or at, let's say, a health facility? And that is what will determine how the community is defined. And then when we come to the definition of engagement, one thing we need to understand is that engagement is not an event, it's a process. And it's a two-way process that involves both the researchers explaining the purpose of their research to the target community, then also allowing the community not only to understand what the purpose of the research is, but also to explain to the researchers what they value as a community and what needs to count as part of conducting that particular research. So in terms of whether there's a universal understanding of community engagement and what it means to do community engagement, I think that is largely context specific, and every researcher needs to first of all start off with understanding what problem they are trying to address, who is likely to be affected by that problem, what the target group is, and where they are located. If they are located in one village or one particular location, then it's easier to engage. But if it's not, then that would also inform the type of engagement or the mode or the process that is used to engage that particular community.
Given this diversity, there must be different ways of doing community engagement. What models of community engagement exist, and what are the goals of community engagement?
Depending on the context in which community engagement is being carried out, there could be several models that researchers could use. But first of all, it's always very important to do some kind of mapping exercise to understand if there are already existing models of engagement that researchers could build upon instead of reinventing the wheel or introducing new models that may not be familiar with the community. One of the most popular models that we see in community engagement is where, especially when the community is located in one particular setting, is to organize community gatherings or to organize community, what we call in local parlance, community derbers, where you bring different key stakeholders within the community, the chiefs, the elders, women leaders, youth groups, to one location where the engagement actually takes place. But again, depending on the context, if the research is being carried out in a hospital setting, it's often very difficult to bring a whole community to that hospital setting. So again, you have to look at who are you targeting in that hospital. Is your target group the healthcare workers or the patients? If it's the healthcare workers, of course, there are opportunities to organize meetings with these healthcare workers. And there are also opportunities to organize meetings with the patient groups. And then also, of course, if the research has implications beyond the individuals who are participating in the research. For example, in the context of genomic research, we do know that the implications of the findings of genomic research goes beyond the individuals who have donated their human biological samples or even their data. And so it's also very important to look beyond models that only target individuals actively participating in the research, to look out for models that would go beyond a particular location. So for example, we have situations where researchers would use local radio stations or even local TV stations to share their research with a larger community, particularly if you're not targeting just one community and there are several communities involved. It may be very difficult to bring the entire community to one particular place. But if you use a radio station, where you go into a radio station and explain your research to the target community, and then also it's not just enough, if you use only radio stations, it will become just a one-way approach, because there may not be an opportunity for community members to be able to ask questions. So that is why in many cases we encourage that radio stations also include a segment which allows members of the community that are listening to the discussions on radio to call in and ask specific questions that they may have about the particular research that is being conducted. And then also that process, that two-way process, also gives an opportunity for the researchers to also learn from the communities, because the communities may have different ideas about how a particular research ought to be conducted, what needs to be taken into consideration, what values should count in the conduct of the research. So that two-way approach of engagement will then allow the researchers to also learn, what we usually would call a process of co-learning, where researchers learn from the communities, target communities, and then the communities also learn from the researchers. But it's also very important to understand that the module that is likely to be used also depends on who the researcher is. There are some research projects where you have local researchers who are actually part of the community. So it is not a relationship of we and us situation. These community researchers are part of the community. They understand the language and they are also affected by the research. So for example, if you're doing a research on malaria, we all know that almost everyone in Africa, almost everyone in any village in Africa would have had some encounter with malaria. So if your target, the focus of your research is on malaria, you need to be able to define exactly what you mean by the community and the module that would be required or would be most appropriate to engage with the communities. Increasingly, so most of some of these modules that I've explained to you sometimes are not formal. They are informal ways of engaging with communities. But increasingly, we are also seeing examples of formal community engagement activities, which would also involve the establishment of what we call community advisory groups or community advisory boards. And depending on, again, the nature of the research, the community advisory board could actually be established by the community themselves or by the researcher. And so it's always very important to first of all understand, is there any community advisory group already existing in that community? And how can the researcher build upon these existing modules to make sure that there's a win-win situation between the researchers themselves and the communities that they are going to engage. And then also there's increasingly the use of science cafes, where researchers use different and innovative tools to explain their research to community members, and then also try to understand the indigenous knowledge that already exists within these communities. So for example, we all know that genomics or biobanking is a very complex terminology to explain in a local language. But it's always very important to not assume that communities do not have any indigenous knowledge about genomics. So instead of doing a top-down explanation or trying to break down the science from a top-down, it's very important to start off with a bottom-up approach. First of all, understand, what do the communities already know about genomics? And rather than using even a term like genomics or biobanking, you may want to start off with, what do they already know about human heredity and health? And it will surprise you to know that most communities know that there are some diseases that are inherited, some diseases that are passed on from one generation to the next. So based on that understanding, researchers can then build upon that and try to fill in any gap that may exist. So using innovative tools like developing video clips, trying to demystify, some of the complex terminologies in science, clinical trials, what it means to randomize, participants in a particular trial. It may be difficult to do that using words, but what usually helps is using tools, using animation, and also using some kind of pictures to really try to get community members to understand better what exactly the researcher is trying to communicate. So what I will say is that yes, there are different models of community engagement, but it also largely depends on the community involved, the nature of the research, and the goal of the engagement. Is it to communicate? Is it to get buy-in from the communities? Is it to ensure that participants, research participants and their communities are actually part and parcel of co-creating the knowledge that is likely to come out of this research?
How does community engagement facilitate the conduct of health research? Is it more useful only for conducting sensitive or controversial research?
Community engagement is not only required for sensitive and controversial research studies. From my experience, some of these controversies often arise when community engagement is actually not done or not done well. It's important to understand that for a community to be actively and meaningfully engaged, it's important for researchers to think about what the value of community engagement would be for their research. And so thinking about the value, both the intrinsic value of showing respect and also ensuring that the target community is not exploited, you would understand that for most research, it's important to engage with the community. There is also the intrinsic value of actively engaging communities. One of the values, intrinsic values of community engagement is that it allows the communities to be able to get some clarity on any sensitive issues they may have about a particular research, so that community engagement doesn't become an afterthought, but something that is thought through right from the beginning. Even in developing or conceptualizing the idea of the research, it's important for researchers to think about what it would mean to engage the community, what community should be engaged, and what models should be used for engagement. So in terms of sensitive research, like I can give you an example of a particular research that was conducted somewhere in northern Ghana, which involved sending research participants to an entomological study, which involved sending research field workers actually to communities to do what we call to catch mosquitoes. Now, to do human landing catches, it's important for field workers to be trained and to expose their limbs to the mosquitoes. And usually the mosquitoes are also collected in the night. So already researchers in that institution anticipated that there could likely be an issue with community members understanding why there's the need to catch mosquitoes in the night, and also to allay any fears that community members may have about any secret, agenda of the researchers. So the researchers, because they anticipated this, as part of their engagement, they did explain to the community members why they will be sending field workers to live in the communities and to stay overnight to catch these mosquitoes. But even even after doing all that, again, we need to understand that depending on the nature of the research and then also the type of engagement or level of engagement that is done, not every member of the community is likely to hear or to be part of the engagement process. And this can lead to misconceptions. This can also lead to rumors. So in this particular research, although the researchers had actively engaged with both the community leaders, the elders, women groups, and had also actually organized community debates, members of the communities who did not participate in these activities got to know about this research and raised concerns that perhaps the researchers may have a different agenda. So it required the research team to actively listen to controversies or sensitive issues that may arise at the community level, even after the engagement activity. That's why I was emphasizing on the fact that engagement is not an event but a process, and it doesn't end after you've organized the community meetings or the community debates or the radio discussion. It's important for researchers to be open, to leave the communication open, and to have people on the ground who would listen to any concerns that members of the communities may have, and to be able to respond to these controversies or to respond to these issues that the communities may raise. Then we also know that for very sensitive studies involving clinical trials, there was a case in 2014 during the Ebola epidemic, and it was clear that yes, there was the need to develop vaccines. But in Ghana in particular, that did not record any case of Ebola. There were some concerns, not even at the community level, but also even among the Ghanaian public about why a phase 1 trial on Ebola was being conducted when there was no case of Ebola. So it then showed that it's important not only to focus on engaging with the target group that are likely to participate in the clinical trial, but to also ensure that the public, the Ghanaian public, wherever you are doing the research within Africa and even elsewhere, that there is some opportunity for researchers to engage with different stakeholders, even including politicians, including parliamentarians, including policymakers, to really understand why the research is being conducted. And it is when researchers do this and actively engage with all these stakeholders and actively ensure that whatever responses or concerns that these target groups and stakeholders may have are addressed. It is this that would end any controversies that are likely to arise.
Do you have any advice for researchers starting a community engagement process?
One key advice that I'll give researchers is to understand that community engagement is an important activity or process that can actually contribute to the ethical conduct of research. It shouldn't be seen as just an event. It shouldn't be seen as just tokenistic or to just get buy-in from communities to get samples or data or to address their research questions. It's supposed to be seen as an important activity or process that can actually ensure that research participants are co-creators of the findings or the results that we often generate from conducting research. Because we need to understand that the end users of our research findings would be communities. If you conduct research and you don't communicate your findings to your research participants and to the communities, then of course you wouldn't have actually addressed your research problem. So I always advise that it's important, think about the community, think about your target group. Just as you develop your research problem or you develop your problem statement, think about what problem you are trying to address. Who is likely to be affected by this problem? How are you going to generate answers to this problem? Where are you going to collect your data? Who is likely to be affected? Who is going to be implicated by your research findings? And think about identifying, first of all, your research community very early on when you are conceptualizing the idea of your research. And then also think about identifying what models already exist and what your position is as a researcher. Because believing that if you don't do the right thing, it can actually also affect the trust that communities and the wider public may have about research in general. We need to also understand that researchers are the face of science. And so depending on how researchers behave in communities, their attitudes towards community members, how they treat or how they respect community members would inform how researchers respond to the research process. So it's very important to start right from the beginning. Understand the goal for engagement, define your community, identify existing models of community engagement, make sure that you take into consideration local perspectives on what really works on the ground. And rather than trying to also use a top-down approach, begin from engaging with key informants at the community level who would help you navigate the community and understand the hierarchies that one has to go through as a researcher. And we also need to understand, given that community engagement is a process, that once we have conducted our research, it's important not to leave the research community hanging. It's important to have an exit plan, that at the end of the day, the communities need to understand when the research has started, when it is going on, and when it has ended. And when it ends, it's even if researchers haven't analyzed their data yet, it's always important to go through that hierarchy using the same model that you used at the beginning of the engagement process, and to go back to say thank you to the community for participating in the research, and let them know if there's a plan to come back to share any findings that one may have. And I'd like to also stress here that I think we tend to do quite a lot of engagement at the beginning of the research when we need buy-in, when we need our data, and when we need our samples. But we also need to understand that we have an ethical obligation to go back to these communities and share our findings with them. Even if you haven't found anything, it's always very important to go back and then share something with the community members. Let them understand what you found, what you didn't find, what the knowledge gap is, and also create some kind of awareness of the importance of the need to go to do more of these research, so that it sets a stage for future research to be conducted within these communities as well. And above all, I think it's important that researchers should be people who have integrity, that they are not only going into that community to use them as a means to an end, but also understand that the communities may also have expectations and not to overpromise. Sometimes there's a tendency to overpromise, but researchers cannot address all the problems that the research community may have. So it's important to be open and honest, let the community know what you can do, what problems you can address, what the remit of your research is, and what your limitations are, so that it doesn't create any high expectations within the communities that at the end they may be disappointed if these promises are not fulfilled. So don't overpromise. Do the right thing. Make sure you go through the protocol, the approved protocol by the ethics committee, and then also make sure that you show respect to the hierarchy that exists within that community, and also take into consideration the voices of the minority that may exist in that community.
What additional value might community engagement have for research populations?
As I mentioned earlier, we need to understand that community engagement has both intrinsic and instrumental values. But particularly in rural settings, where community members may not be in a position to really understand the science behind the research that is being proposed, community engagement can serve an important role in trying to demystify the science behind the research. If you go to many communities in rural settings, of course, you also find that there are a lot of vulnerabilities. And so there's also an important opportunity to use community engagement to promote health literacy and also to promote, research literacy as well.
What about urban settings? What are the challenges of doing community engagement in an urban setting?
From my experience, it's even easier to do community engagement in rural settings because the hierarchies are well laid down. The traditional authorities are clearly defined. So it makes it easier to be able to go through the community leaders and then to also even organize community debates. But what the challenge has often been conducting or organizing community engagement activities in urban settings. How you define a community in an urban setting is very important because you may have different communities that live in the same geographical area that may have different, community leaders. And the challenge would be, how do you navigate this process? How do you identify who the gatekeepers are? How do you identify who the main community leader is to be able to even consult them before approaching individual research participants to get some kind of buy-in? So again, in urban settings, it's always very important to understand that you can still define community based on the common ideas or the common values that exist within that particular community. And we are increasingly seeing the use of social media as a way of engaging communities in urban settings. So even if people live in, say, an estate, you find that they would belong to one particular WhatsApp group. And if you want to be able to engage them, you can send messages, share, some of your research ideas through the WhatsApp messages. Leave, your phone number, leave, contact information on the WhatsApp group so that these individuals can contact you for further information. And I think that's something that has worked well in urban setting. And of course, the use of, traditional media like radio and television as well has also served a very good purpose. So I think that it's very important not to assume that just because a particular setting is exposed to some vulnerabilities or a particular setting is already modernized, that they may not necessarily benefit from community engagement. It's important to understand what already exists in that particular community and then also be able to do some kind of mapping and understand what their needs are, whether they are in a rural community or an urban community. There are models and there are ways in which you can actively engage with these communities.
Some studies set up community advisory boards. What exactly is a community advisory board? And are there particular studies where they're more suited?
The role of community advisory boards is to serve as a liaison between the community and the research team. Now, members of the community advisory boards can usually be selected by the community themselves or by the researchers. So you can have two different models of community advisory boards. A community advisory board that is already existing in the community, that has been established by the community, and that is not, which has a role not specific to any particular research, but to serve as a liaison between the community and any research that is being conducted in that particular community. A second model is a community advisory board that is established by a particular research project. So, for example, if the research is on HIV, a researcher could, in consultation with community leaders, select key members of the community who will serve as the liaison between the community and the researchers. Now, depending on what model that the researcher is using, it can have its advantages and disadvantages. A community advisory board that already exists in the community is sustainable. It's not attached to any specific research. So even when the research ends, that community advisory board already exists. And any researcher who wants to come to that community can consult this advisory board. And they are usually independent, of the research. They are not paid by the research. So again, there is no conflict of interest. They are not biased. And what the role they play is to ensure that they bring the voices of the communities, the concerns communities may have. They ensure that the values of the community are taken into account in the conduct of the research. And they also ensure that they communicate or educate other members of the community about the research. The second model, which is usually established by a research team, or that is usually closely tied to a research activity or a research project. Yes, for that particular model of community advisory board, it's often driven mainly by the researcher. So the challenge with that model is that then when the research ends, the community advisory board dissolves. So there's no sustainability in terms of ensuring that there's a body that continues to remain in the community and educates the community about research in general. And depending on the type of research that one is conducting, if you have a very short research project, 3 months project, or even 6 months project, it may be a bit difficult to establish a whole advisory board just purposely for that particular research. And when the research ends, then say the advisory board ends. But if the community advisory board already exists, it would not matter if the research is for 3 months or even for 5 years. But we do also know that it's not every community that has a community advisory board. So in many cases, you find that the researchers would have to work with the communities to establish new advisory boards. But what the advice that we often would give to researchers is that establish this advisory board in a way that is sustainable, that the board can remain in the community and continue to educate the community and continue to be there as the liaison for even future research, so that it doesn't just lead to a tokenistic approach of just establishing a short-term, advisory board and then leaving them and packing out when the research ends. For some studies, especially if it's a community-based research, it works really well to have a community advisory board, because if you use a community there, but not everyone would be able to attend the community gathering or the community meeting. But because the members of the community advisory boards live in that community, they can serve as the liaison and continue to provide information about the research to the community members, and also be the ear on the ground that listens to what the concerns of the communities are and communicates this to the researchers, so that it sort of strengthens the engagement process, and it doesn't become just an event but also a process beyond the duration of even the data collection period. There are also situations where researchers would establish what they call patient advocacy groups. So beyond the community advisory boards that you would find at the community level, depending on how the researcher is defining their community and the research setting. If it's particularly in the context of the research is being conducted in a hospital-based, it's always very good to have a patient advocacy group. And in fact, increasingly, we are seeing a lot of these advocacy groups coming up. You have kidney disease patients forming advocacy groups to fight for their rights. You have diabetes groups coming up to set up advocacy groups, the HIV community coming up to set up advocacy groups. So these advocacy groups also exist and can be a key body that can serve as that liaison, not only to facilitate recruitment, but also ensure that the concerns of the target community is also taken into consideration. And so it's always very important, start off with, during your mapping exercise, find out, is there any existing advisory group? If there's no existing advisory group, how can you facilitate, as a researcher or research team, facilitate the establishment of an advisory group in consultation with gatekeepers of the community, or in consultation with hospital or facility administrators, especially if you are doing a hospital-based research, and ensure that at least this is a group that is sustainable. This is a group that you can come back to, especially when you have findings to share with your research participants. In a recent study that we did in one of the teaching hospitals in Ghana, we set up a community advisory group that would serve as the mouthpiece for the patients who were donating their samples for kidney disease research. The challenge has been that once the research ended, it was difficult then to be able to sustain it. But what we are trying to do as a consortium is to try to look at how do we sustain a group like that. So we are putting in place some strategies that would enable us to go back to this advisory group to try to understand what their needs are. In what ways can we sustain a group like that? How do we ensure that there is continuous communication between the advisory group and the community? And this kind of bottom-up approach will then help the research team to be able to sustain the engagement process that is going on within that setting. So again, in terms of particular studies that are more suited for community advisory boards, again, it depends on the nature of the research. If it's community-based, a long-term research, by all means, get a community advisory board, either existing one. If it's one that is a very short period, identify a group that can advise. But again, it depends a lot on what the communities want. And don't only rely on just the community advisory boards alone. Make sure that you still create an opportunity for some kind of communication between the researcher and the wider community. And then, of course, with the community debates and the community gatherings and the radio station, and then the use of innovative strategies, I think that can also help support, not only existing community advisory boards, but also ensure that the target communities actually meaningfully and actively engaged throughout the process.
There's a notion that community engagement takes time and resources away from the actual research study. What would you say to that?
It is true that community engagement takes time and resources, but I don't think it's accurate to say it takes this time and resources away from the actual research study. So it depends on what you see as one would see as community engagement. I think community engagement is an integral part of the research project or any research study that we are conducting. Yes, with time, if you start early, in identifying your key stakeholders to engage with, and also make sure that you have budgeted, for the engagement process, making sure that you have the right personnel, to help you with their communication, making sure that you have the right venue, making sure that you have the right resources to provide a place of like chairs, tables, and other things, transport, which are all, resources that you would need to be able to organize, a very good community meeting. All these, come with a cost. So yes, it's important for you to be able to budget for this, but I don't think that it is budget that should be taken from the actual research study. I think community engagement should have its own, budget. And I think increasingly we are seeing that happening. I sit on an ethics committee, and then often when you review a research proposal, you would see clearly, and it's changing. In the past, most researchers were not describing their community engagement activities, and they did not have a specific budget for community engagement. But this is changing. And I think that even funders are beginning, to support, to provide funds for community engagement activities. So yes, community engagement takes time, and that is why you need to start early. And it also requires its own resources, not using the actual research study. And that's why you need to have a separate budget for community engagement. And I think sometimes people would say, well, is it cost effective, to put in all this time and all these resources for community engagement? What value will it add? Look at the flip side and look at what it would mean to not do community engagement. If you don't do community engagement and there's no community buy-in, you will not get your samples or even your data. And yes, maybe if you find a way of getting your samples and data, at the end of the day, if there's no uptake of your research findings, then all the investment, even in conducting the actual research, would have gone to waste. So it's always very important not to dwell too much on the time or the resources that are required, but looking more at the value, both the intrinsic and instrumental value of community engagement to the actual research process. And then to see it not also as, a separate activity, but an integral part of the research, so that when you are budgeting for your reagents, when you are budgeting for personnel, when you are budgeting for transport, for data collection, when you are budgeting for data analysis software, you can also incorporate a budget for community engagement, which would also include transport, which would include personnel, which would include even tools that you need to develop, like animation. And also when you want to do engagement, even public engagement with the media, it comes at a cost. So you need to be able to take all that into consideration and make sure that you are adequately prepared. And then to see community engagement as a process that will rather enhance the research project and not take away too much from the research project.
Another advisory body supporting health research is the Research Ethics Committee. Is there a potential for conflict in the advice rendered by the various research advisory committees supporting health research? How can such conflicts be resolved?
I think some conflicts can arise when community engagement is not when community engagement is not done properly. Community advisory boards have a specific role to play to ensure that the voices of the community, including even parents who may have, certain challenges or have certain concerns about the way either the consent process is being done or the way they are being engaged or the way or the type of data or questions that are being asked of their children, may be able to communicate this through the Community Advisory Board. But it's important for us to understand that there are different key stakeholders involved here. That the researchers who have developed the research based on an identification of a research problem or a knowledge gap that they want to address. The ethics committee serves as a gatekeeper. And remember that the ethics committees also have community representatives. So the voices of the community are also represented on the ethics committee. Then you have the Community Advisory Board that serves as the liaison between the community and the research team. Ideally, there shouldn't be conflict between the ethics committee, between communities, and then the Community Advisory Boards and the researchers, particularly if the engagement has been done well, and particularly if these different groups know the remit of their decision making as ethics committees and also as community advisory boards. Where there are conflicts, and usually I don't find a lot of these conflicts happening in my line of work, but where there are conflicts, one good thing to do would be to be able to bring the community advisory boards and the ethics committees together. In practice, you find that ethics committees work independently, which it should be. Community advisory boards work independently, and it should be. And then, of course, researchers also do their independent research based on approval by the ethics committee. But we are increasingly seeing that it's important to be able to provide a platform to bring these groups together, because after all, they are all aiming to make sure that research is conducted ethically, and that research participants and communities are not exploited, and that research is done in a way that is respectful, that reduces any burden and maximizes any potential benefits from the research. And at the end of the day, that at least communities or generations would benefit from the research. So I think all these groups have a common goal. So where there are conflicts, one good advice would be to bring these groups together, to really understand what is at stake, who is playing what role, where is the conflict coming from, and what is the best solution to address these conflicts. And I think that kind of collaboration, would really help to address any conflicts that are likely to come up.
How does community engagement differ from public engagement and stakeholder engagement in research? Which type of engagement is best suited to a particular situation?
So the principles behind community engagement and public engagement are similar, but the process may differ depending on the goal of engagement. When we talk about community engagement, we are specific, the community is specific, and the engagement strategy is specific. Now, public engagement is broader. So because I'm based in Ghana, I can use the example. When you talk of community engagement, we can say we are going to engage with the Kasina Nankana community or the Ga community in a location like Nima or a location like Choco. But when you talk about public engagement, you are not specific, it's not specific to a particular community. You are looking at the Ghanaian population. So you're looking at a larger population. So you're talking about the Ghanaian public or the Kenyan public, or the Ugandan public, depending on where you find yourself. So public engagement is broader. And in many cases, we use more open, and formal, strategies to engage with communities. If you are going to do public engagement, it may be very difficult for you to organize a community meeting. There's no way, realistically, you can get every Ghanaian under one roof and share your research with them. But with community engagement, it is possible. And what determines whether to do community engagement or public engagement depends on the type of research you are conducting and the implications of your research. There are some research projects that, yes, a particular community may be giving you the data or the samples, but the implications would be far wider than that particular community. So you want to be able to use public engagement strategies, which may include using traditional media, radio, television, sharing leaflets. In other places, what people will do is to use information vans that go around several communities to share information about that particular research. The only challenge with public engagement is that depending on the strategy you use, it becomes a one-way process, because the best you can do is to share information about your research to a wider community through a radio discussion. But it will be difficult for, again, depending on even the radio station you are using, not every Ghanaian or not every person in a particular population will be listening to that information or that discussion at the time you are presenting it. So again, you may end up losing a lot of information, or a lot of opportunities for actual engagement. In my experience, it's always better if you have the time and the resources to do both, because it's easy to do that. You can do the community engagement, target the group, try to address any fears that they may have, and then also do a public engagement activity. The example I gave you about the Ebola vaccine trial, the failed Ebola vaccine trial in Ghana years back, had to do with a lot of public misconception about the research. So there are some specific research projects that are also a bit controversial. So you may want to be able to use public engagement strategies to allay any fears that people may have. So when it comes to vaccine trials, there's vaccine hesitancy, and it's not just limited to just one particular community, but it would also have implications for the wider public. So public engagement may be best suited. But if you really want to be able to get active engagement and feedback from the target community, then it's best to use community engagement strategies. And community engagement strategies would also help you to be able to address minority groups and hard to reach communities as well. Because again, some of these hard to reach communities may not have access to some of the traditional media you may be using for your public engagement. So another key difference we need to look at is community engagement and stakeholder engagement, and when to use what type of engagement for a particular research. As I explained, community engagement is usually very specific to a target group or target community, and often we use a more targeted approach, be it community gathering, be it using, other innovative ways of engaging with that particular community. Now, stakeholder engagement is much broader, similar to public engagement, but stakeholder engagement is much broader. It goes beyond the target community where the research participants will be recruited from, to include other groups that may have a stake in what you are doing. So let's take the case of malaria. If you are doing a malaria research, of course, you want to be able to target a particular community where you'll be collecting your sample. So your target community may be a group of people who are located in a particular setting, either in a rural setting or an urban setting. So that would be your target community. But we all know that doing malaria research goes beyond just that specific community. You need to take into consideration other groups like policymakers, like national malaria control programs, like implementers, non-governmental organizations that may also have a stake in the research that you are doing. And that is very important, because we need to understand that sometimes when you do research, in terms of implementation of the findings or uptake of the findings, or in terms of the translation from research into policy, you need to make sure that policymakers are actively engaged. And I think that is an area that hasn't been taken seriously, but now picking up a lot. Because sometimes we find situations where researchers, yes, would engage with target communities, collect their samples and data, get their findings, and then publish, and then expect that, naturally, policymakers should be able to pick these findings and then translate them into policies that would then eventually also translate into practice. So if we want to really be able to bridge the gap between research, policy, and practice, then we need to go beyond community engagement to include key stakeholders as well, who can not only support the implementation of the research, but also make sure that there's uptake of the research findings. I think that is something that should help researchers decide on whether they are going to do only community engagement or stakeholder engagement. And of course, stakeholder engagement also requires some kind of mapping. Which stakeholders are relevant for this particular research? Which government agencies should you be bringing on board? Who are the policymakers? Who are the in terms of even the Ministry of Health, which agency under the Ministry of Health should be actively engaged in the process, so that to make sure that at the end of the day, remember, research is to generate knowledge, generalizable knowledge. And the knowledge is supposed to help address a particular problem within a community or within a particular population. And researchers, based on their remit, may not be able to continue the process of the translation if they don't bring in these key stakeholders. So that is why it's very important to really think through carefully what is the goal of the research. Where do you want to see the research findings end up? Is it just in a publication, or do you really want to make sure that the research findings are actually translated into policy, and that these policies are also implemented in a way that would influence practice? And that influence in practice is also what end up empowering communities. So the knowledge then ends up empowering communities as well. So we need to be able to think about not just community engagement, but at the end of the day, what it would mean to have some research findings translated into policy and then also to influence practice.
In conclusion, the definition and process of community engagement is context dependent. Community engagement has intrinsic value in helping to build trust and instrumental value in supporting ethical research. It can also strengthen science and health literacy for the communities. Community engagement is a two-way process. It is both about listening and talking. In other words, it's a process of co-learning and co-creating knowledge. Community engagement takes time and resources, and it must be budgeted for. Community engagement is a continuous process, not one event, and not opportunistic. One must listen to ongoing concerns and provide ongoing feedback. Use of innovative tools such as videos, animations, pictures, drama, and even the social media can aid community engagement. Do not assume that communities have no indigenous knowledge of science or medicine. Build upon what already exists. Use a bottoms-up approach where possible. Meaningful engagement is said to occur when both the communities and the researchers have a common goal with respect to the research study, and the communities feel empowered to understand the knowledge and derive benefit from the co-creation of knowledge. If communities provide feedback that is conflicting with the feedback provided by ethics committees, it is a good idea to bring the two together, to listen to each other and find a common ground.